I want to ask you a question on the risk factors. I know that there will be a relationship definitely between the risk factors and the causes. But even at that, talk to us. What are the risk factors?
I think just as you mentioned, just as we said during the conversation, we said that risk factors for cleft are a myriad and they could be divided into genetic factors as well as environmental factors. More is an association between the genetic factors as well as the environmental factors. Genetic factors will mean that there is a tendency because of your genetic makeup to have a cleft. And then environmental factors will be other things aside from genetic factors. And we had mentioned several conditions like tobacco, alcohol, rubella, exposure to radioactive substances as some of the things that cause this thing. But we have also found out, even recently, that consanguineous marriages are also common factors that lead to clefts. Consanguineous marriages would be things like a person marrying their cousin. In other words, their genetic lines seem to be somewhat similar. So when you have consanguineous marriages, these are things that typically would occur and typically causes clefts to occur. A woman who is aged above the age of 40 years old might also have a tendency to have kids with congenital abnormalities such as Down syndrome and also cleft conditions too. We also notice that when the age difference between two partners, the father as well as the mother, is significant, perhaps like about larger than 10 years, we also notice that there's a tendency for them to come down with a child that has a cleft.
And then prevention, how do we achieve that?
That is a fantastic question. And it's a bit cheesy. Let me put it that way. The reason I say this is basically because it's a congenital condition. And just like with most congenital conditions, you usually would not be able to say this is what should be done to prevent clefts. However, we could ask that, or we could say to most mothers to try as much as possible to reduce the risk factors. So if you're a smoker, if you're somebody that drinks, these things are known to cause some mutations within your genes. Perhaps you could take that in moderation. We may also want to seek to advise people to marry for love, but maybe marry far and marry someone that is close to your age. I mean, I think that's the cheesy aspect of this, essentially because there's a proven correlation, given the examples I have given in the past, with the formation of clefts. We can do well with advising and also ensuring that the society actually accepts people with cleft problems. And I think that is the direction that we should be going towards. Advising them that, look, kids are born with clefts. They didn't give birth to them because it was their choice to have clefts. It was basically because of certain issues that are genetic that made them to have such conditions. So for the most part, we can only try to mobilize the society and sensitize the society about what clefts are, but concerning the prevention, issues that have a genetic matter, it might be a tough call, as it were, given the circumstances.
Well, talking of stigma, in your experience, talk to us. What has been the experience so far, especially with families and parents of children with this abnormal, this congenital condition?
We see scenarios where there is infanticide in the sense that parents will take their newly born kids and kill them because they do not like the facial appearance of that child. In many instances too, we have also seen scenarios where people might have an accepting behavior because the community and the people within that community see a cleft as the sovereign act of God. And for the most part, this is common within northern Nigeria. But we have noted and experienced that in the southern part of Nigeria, the scenario is a bit much more different. We observe that the accepting behavior is not as common as it is in northern Nigeria. And a study that was done sometime in the early part of the century observed that infanticide might be common in southern Nigeria than it is in northern Nigeria. The reason might not be far-fetched. It might be because of our general belief system. It's been noted that in some instances, people will say because of some sin that you might have committed in the past, that's why this thing is coming to get you. In some instances, we have had people say that because mothers come out at night, evil spirits have entered into the mother and caused the child to look in that particular way. In some instances, it might also be said that maybe because we didn't greet some village people, that's why these things happen. We have had all sorts of things from qualitative studies that we have done. But more importantly is still the known notion and the known fact that clefts are actually caused by genetic causes as well as environmental causes. And a combination of these things is what typically would give rise to clefts. But we also need to educate the public as to how they should have accepting behaviors of the cleft child.
Well, finally, how can this be corrected?
So the treatment for cleft is essentially surgical, and that is where we come in as oral and maxillofacial surgeons. Plastic surgeons also do the same surgery, and there are various types of cleft surgeries that we do. We ensure that we follow the rules of 10. That is ensuring that the child is 10 weeks and the child is 10 pounds and has an hemoglobin level of 10 grams per DL, while ensuring that we set up a proper system where the child is subsequently treated. We manage a lot of problems from the cleft and the appearance, the palatal problems, the dental problems, and a myriad of issues that a cleft child would have, including ear problems and also nose problems. These are things that are managed by the oral and maxillofacial surgeon and sundry departments. There's also the aspect of psychological evaluation and psychological counseling, which continues until when the child is even an adult, because such children usually have their issues when they get older, and some of them are even known to be prone to stress, anxiety, and depression much later on. But essentially, it's a treatment that starts when the child is really young, up to when the child is even old, or even to the point where the child is even getting married. Treatment for the cleft child continues.
Thank you, Doctor, for sharing your thoughts with us.
Same here. Thank you so much, Perpetual, and thanks for having me.
Well, thanks for joining us. We've been speaking with consultant, oral and maxillofacial surgeon. He goes by the name Dr. Akinwale Akinlade. Have a great day. My name is Perpetual Fasami Peter. Bye for now.